beyond positive and negative symptoms of schizophrenia. Although not recognized formally as part of the diagnostic criteria for schizophrenia, numerous studies subcategorizes the symptoms of this illness into 5 dimensions, not just 2. And the other 3 are the cognitive symptoms, aggressive symptoms, and affective symptoms. Now let us discuss the first, aggressive symptoms. Now these include assaultiveness, verbal abusive behavior, and frank violence. For this, behavioral interventions may be particularly helpful to prevent violence linked to impulsivity by reducing provocations from the environment, as well as certain antipsychotic drugs such as clozapine or very high doses of standard antipsychotic drugs, or occasionally the use of 2 antipsychotic drugs simultaneously may also be helpful in aggressive symptoms. Now coming on to cognitive symptoms of schizophrenia. Now these are impaired attention and information processing that is manifested as impaired verbal fluency, problems with serial learning, impairment in vigilance for executive functioning, that is problems with sustaining, focusing, concentrating and prioritizing attention, and finally inability to modulate behavior based upon social cues. The second domain is executive dysfunction, which includes problems with representing and maintaining goals, allocating attention resources, evaluating and monitoring performances, and utilizing these skills to solve problems. Now these cognitive symptoms of schizophrenia are important to recognize and monitor because they are the single strongest correlate of real world functioning, even stronger than negative symptoms. Now let's once again summarize the cognitive symptoms of schizophrenia. These are problems representing and maintaining goals, problems allocating attention resources such as focusing, sustaining, dividing and shifting attention, problems evaluating, monitoring and prioritizing functions and performances, impaired verbal fluency, problems modulating behavior based upon social cues, difficulty with serial learning, and finally difficulty with problem solving. Now coming on to the affective symptoms of schizophrenia. These are similar to symptoms associated with either mania, depression or both. Now different symptom domains of schizophrenia are hypothesized to be regulated by unique brain regions. The positive symptoms of schizophrenia are hypothetically modulated by malfunctioning of mesolimbic circuits, and the negative symptoms are hypothetically linked to malfunctioning of mesocortical circuits and may also involve some mesolimbic regions, such as nucleus accumbens, which is part of the brain's reward circuit and thus plays a role in motivation. It may also be involved in the increased rate of substance use and abuse seen in patients with schizophrenia. Affective symptoms are said to be associated with the ventromedial prefrontal cortex. The aggressive symptoms related to impulse control are associated with abnormal information processing in the orbitofrontal cortex and amygdala. And finally, the cognitive symptoms are said to be associated with problematic information processing in the dorsolateral prefrontal cortex. Although there is overlap in function among different brain regions, understanding which brain regions may be predominantly involved in specific symptoms can aid in customization of treatment to the particular symptom profile of each individual patient.